Have you ever been told you need surgery right away and felt like there wasn't time to ask questions? For many adults over 70, certain procedures are presented as routine or urgent. But here's something most people aren't told often enough. Not every recommended surgery is automatically the best option. Sometimes the risks outweigh the benefits, especially later in life. Today we're going to walk through 14 medical procedures and situations where older adults should slow down, ask more questions, and fully understand their options before deciding. This is not about rejecting medical care. It's about making informed choices that protect your independence, cognition, and quality of life. And make sure you stay until the end, because the final points could completely change how you approach medical decisions after 70. Growing older brings wisdom, experience, and resilience. But it also brings changes in how the body responds to medical treatment. Procedures that may be routine for someone in their 50s can carry different risks in their 70s or 80s. Recovery may take longer. Anesthesia can affect cognition differently, and the goals of treatment may shift toward maintaining independence and daily function. That's why many doctors today emphasize something called shared decision-making, where patients and physicians carefully evaluate whether surgery is truly necessary. Let's take a closer look. 1. Spinal fusion for chronic back pain. Spinal fusion is sometimes recommended when imaging shows degenerative changes in the spine. But here's the important context. Many spinal changes seen on MRI are part of normal aging. For adults over 70, spinal fusion can involve major surgery. Long recovery periods. Risk of complications such as infection or reduced mobility. For chronic back pain without severe nerve compression or instability, many experts recommend trying non-surgical treatments first, such as physical therapy, core strengthening, pain management strategies, lifestyle adjustments. For some people, surgery helps, but for others, conservative care provides similar relief without major risk. 2. Carotid artery surgery for mild narrowing. The carotid arteries supply blood to the brain. When these arteries narrow, procedures like carotid endarterectomy or stenting may be considered. However, in patients with mild narrowing and no stroke symptoms, studies suggest that careful medical therapy, blood pressure control, cholesterol management, antiplatelet medication may reduce stroke risk effectively. In older adults especially, surgery itself carries a small but real risk of stroke during the procedure. That's why many specialists recommend individual risk evaluation before deciding. 3. Knee replacement for mild arthritis. Total knee replacement can be life-changing for people with severe joint damage. But when arthritis is still mild or moderate, doctors often recommend starting with physical therapy, weight management, muscle strengthening, anti-inflammatory treatments. Knee replacement requires major surgery, months of rehabilitation, strong participation in recovery exercises. For many seniors who still function well, delaying surgery while improving strength can sometimes preserve mobility longer. 4. Coronary stents for stable heart disease. Stents can be life-saving during a heart attack, but in people with stable coronary artery disease, research has shown that medications and lifestyle management can sometimes be just as effective for preventing major events. Stenting may still help people with severe symptoms that do not respond to medication. The key question is whether the condition is stable or unstable. A thoughtful conversation with a cardiologist can help determine the best strategy. 5. Prostate surgery for mild urinary symptoms. Benign prostate enlargement is extremely common as men age. Symptoms may include frequent nighttime urination, urgency, weak urinary stream. For mild symptoms, doctors often recommend trying lifestyle changes, medication, monitoring, before considering surgery. Surgical procedures can help in severe cases, but they also carry risks such as temporary urinary issues, infection, anesthesia complications. The decision should depend on how much symptoms truly affect quality of life. 6. Aggressive surgery for very slow-growing cancers. Some cancers common in older adults grow very slowly, including certain forms of prostate cancer, thyroid cancer, small kidney tumors. In selected cases, doctors may recommend active surveillance, meaning careful monitoring rather than immediate surgery. This approach can sometimes allow patients to avoid major operations without compromising safety. Treatment decisions should always consider Tumor behavior. Overall health. Personal priorities. 7. Complex heart valve surgery in frail patients. Heart valve procedures can restore function and prolong life, but traditional open heart surgery may carry higher risk for frail or medically complex seniors. Today, many cardiologists evaluate whether less invasive options, such as transcatheter procedures, might be safer alternatives. Each patient's health profile matters greatly in deciding which path is best. 8. Extensive spinal decompression procedures. Large multi-level spinal operations can be physically demanding. In older adults, recovery may include long rehabilitation, risk of falls, reduced independence during healing. For some patients, targeted physical therapy and pain management may improve mobility without large procedures. 9. Shoulder replacement for manageable pain. Shoulder replacement can restore function when arthritis becomes severe. But when pain is moderate, many orthopedic specialists encourage trying strength training, physical therapy, anti-inflammatory strategies before moving toward joint replacement. 10. Preventive surgery without clear symptoms. Some procedures are offered based primarily on imaging findings, not symptoms, but imaging does not always reflect how a person actually feels or functions. For older adults especially, the decision to operate should consider functional ability, pain level, daily independence, not just what appears on a scan. 11. Major abdominal surgery for benign conditions. Some non-cancerous conditions can technically be corrected surgically. However, abdominal surgery carries higher risk for older adults, including blood clots, infection, delirium. Sometimes monitoring or less invasive treatments may be appropriate alternatives. 12. Repeated revision surgeries. When joint replacements or implants fail, revision surgery may be suggested, but revision procedures can be more complex and demanding than the original surgery. Doctors often weigh whether the expected benefit truly justifies the risk in older patients. 13. Procedures recommended. Without a second opinion. One of the most powerful tools in medicine is a second opinion. Many major medical centers encourage patients to seek one before major orthopedic surgery, heart procedures, cancer surgery. A second opinion can confirm the plan or sometimes reveal less invasive options. 14. Any surgery that doesn't align with your personal goals. Perhaps the most important question of all is this: what matters most to you? For some people, the priority is living as long as possible. For others, it's maintaining independence, mobility, or cognitive clarity. The best medical decision is the one that aligns with your values, your health, and your life priorities. Final thoughts. Closing. Reaching your 70s and beyond is not a sign of weakness. It's evidence of a life lived, decades of experience, resilience, and wisdom. And that wisdom gives you something powerful, the right to ask questions. You can ask, is this surgery urgent? Are there safer alternatives? What are the real risks at my age? How will this affect my independence? Good medicine isn't about doing everything possible. It's about doing what is truly beneficial. And when patients and doctors work together with clear information, the result is almost always better decisions and better outcomes. If you found this information helpful, let us know in the comments which of these surprised you the most. And if you know someone over 70 who might benefit from hearing this perspective, consider sharing this video with them. Your support helps us continue creating content that empowers people to make informed health decisions. Stay curious, stay informed, and we'll see you in the next video.